and antibiotics if it is infected. And then surgical correction will be required in many cases, which can be best judged by the surgeon after examining, and which is of course you have to contact your doctor, local surgeon, and then the operation, other variety of operations which are available with the various results, and again the best operation will be decided individually for the individual patients. And the operations, you should be always aware that all operations are not without any complications. All the operations have got some complication which you should be aware before you undergo any surgical procedures. So say the one which we showed earlier, after correction, it will the toes look more straight, the foot is narrow in front, and it is more comfortable to put your shoes. Then I will come back. I'm jumping from the toes to the ankle again. So the ankle arthroscopy, if we have got arthritis, which I already told, this is one of the, how do we put this patient on the table. And now this is, I'll discuss the another common condition is rheumatoid arthritis. Rheumatoid is a condition which involves most of the joints. We see rheumatoid arthritis in spine, we see in the hips, knees, as well as toe joints. And this is a very painful condition. And again, I've seen many people just neglect it because it is one of the condition which can be easier to treat and which can also after the correction, the patient will be very, very thankful to the surgeon because it becomes more pain-free. Because these people suffer a lot. So these are the situations where we see the rheumatoid arthritis, where the toes are deformed, and also you get to see the flat foot is got secondary flat foot as well. And now you see the callosities under the feet here, which is all because there is only no fat underneath. It is all bone onto what we call walking on the bones, because you are basically there is nothing, no cushion effect underneath the metatarsal heads. Oh, that is another situation, and this can be operated by a variety of operations are described. Like we have to make the joint straight, take away all the diseased joints. Simple, not a very major surgical procedures, but very, very beneficial for the patients. And then again, there is a straightening of the toes. Now, this is another common condition which everybody in their lifetime have this once in a while, the heel pain. And this is a condition where people and sometimes the clinicians are at loss to treat. And this is what we call in the medical terms known as the plantar fasciitis. The pain starts at the heel. This is the plantar fascia, which is a tight fascia, and this is where we get the pain. There is an extra bone formation sometimes which we call spur, which is not can be a result, but that's not necessarily that somebody has got a spur should get heel pain. The heel pain comes without a spur as well. Then most common causes again is because of the wearing tight shoes, non-supportive footwear, the shoes with very hard insole, and then obesity, of course, will add further to the symptoms. Then symptoms are usually pain at the bottom of the heel, then pain on the arch of the foot. The pain is worst when you get up from the bed and put your foot on the floor, and it just goes on increasing over a period of months, and then people then this is the best way you can treat it yourself by following exercise, following the instructions here. You have to do stretching exercises. You have to stretch your half. You have to stretch the forefoot. Means you put a towel around the toes and try to pull it so that the heel part is stretched. And then this, I think if people have got this, if you do it before putting your foot down onto the ground, will be much helpful. Then of course don't walk barefoot, put ice if it is very much painful, and you have to cut down physical activities, it again is very painful. Shoe modifications, you can have heel pads in soles which will give nice cushioning effect. And then of course in conditions where we still getting painful, then you can take medications. And of course this is again further to it, like orthotic devices. We got various of even surgical shoes